Growing up, I heard so many dirty jokes that all talked about Viagra, Viagra, and Viagra. And for the longest time, I had no idea what it was, apart from a joke. So today I thought we can talk about Viagra. What is it? Who should use it? Can it be harmful? But first, welcome. I am Artika and you're watching Allo, Ask the Sexpert, a space where we invite sexual health and wellness experts to talk about sex, sexual medicine, health, pleasure, and so much more so that you can have better sex backed by science. Today's expert is a psychiatrist, andrologist, and a sexual medicine expert with Allo Health, Dr. Karthik. Welcome, Dr. Karthik. How are you doing?
Thank you, Artika. Nice to be back here again.
It's lovely to have you here again. So I think today's topic, which is Viagra, is something that a lot of boys write to us that they want to know about. There are concerns. Some of them are excited to use it. So I thought, why not pick it up and have a sexpert come and talk about it?
Quite an interesting topic. Okay, so it's a drug which changed, the pharma company as such. Okay, because Viagra is actually a trade name.
Okay.
Okay, it was introduced by a company called Pfizer. Most of you would know that company.
I think after COVID, everybody knows.
Yes. Okay, but frankly speaking, it is sildenafil. It's called sildenafil citrate.
Right.
Okay. Viagra was actually the brand name that Pfizer gave when they introduced the drug long back. Okay, so would you want me to throw in some light on how it acts, on what it is, everything?
Yes, absolutely. I think you should lead today's conversation. That'll be so helpful for me.
Surely. Now, let's say biologically speaking, whenever there is sexual stimulation from the body, there are certain chemicals, neurotransmitters, which come down from the brain. At the end of it, brain is the master organ. Even that needs to tell the personal organ to get an erection. The way it works is whenever there is a sexual stimulation, a chemical comes down, acts on the penis, and releases a small chemical called nitric oxide in the blood vessels. That does nothing, but it increases the diameter of the blood vessels for that time being. Okay, that is why instead of coming in a smaller pipe, the blood is coming in a bigger pipe. So that is how we get a hard enough erection. Okay, now what they discovered initially was people who are having difficulties in achieving an erection. They found out that their nitric oxide content in the blood vessel was very, very low. In other terms, let's say their blood vessel quality was on the lesser side. Okay, so what Pfizer discovered was a drug which inhibits destruction of this nitric oxide, which in simple terms, whatever the quantity of the nitric oxide is there in your body, it makes it stay inside your blood vessel for a longer time. So as a result, your blood vessels stay opened up for a longer time. Now, the irony of this is actually this does not happen only in the personal organ. This happens even in the heart. Let's say you're exercising.
Like dilation you're talking about?
Yes, you're exercising. Your heart needs more blood. So what happens? Brain sends the stimulus and the same nitric oxide is released near your heart so that your heart gets more blood. Okay. Why am I stressing on this point is usually when we talk about erectile dysfunction or sexual health, we kind of restrict ourselves only to that. But this actually, Pfizer itself did a study. This is an indication that whenever there is a problem with erection, the body is actually telling you that your blood vessel quality is low when I speak organically. So not only you are at a risk of sexual health problems, you are actually at a risk of a heart attack or any brain event, stroke, what we say in common terms. So this indicates that your blood vessel quality is low. Now Viagra, coming back to the topic, helps you very specifically only to keep those blood vessels dilated. So whenever you pop in a pill, you get a hard enough erection.
Got it. I think so much of the signaling around Viagra or the way we read it in books, movies, etc. is about Viagra being associated with stamina.
Yes.
And hence leading to more pleasurable or better sex, so to say. But scientifically speaking, I think vasodilation is what Viagra induces, which is the dilation of the blood vessels. And that's how it actually works. So that was very interesting to know. Definitely. I think you spoke about, very briefly, you spoke about brain strokes and risk of cardiovascular diseases. That brings me to a point where I want to talk about what are some of the side effects of Viagra? Can there be side effects? And
Yes, there's absolutely no absolute contraindication. Anybody can pop in a Viagra.
right.
Now there are better drugs than Viagra.
Okay.
Viagra, as I told you, was sildenafil. Now there is a longer acting drug called tadalafil.
Okay.
There is even better drug called as udalafil. Okay, there are various other drugs.
Right.
Speaking. Now again, the cost differs from, let's say, Viagra 50 mg will cost you 25 rupees. Udalafil 100 mg will cost you around 550 rupees. Okay. Now why udalafil is expensive is because it's very specific. As I told you, Viagra is a vasodilator. Now, unfortunately, what it does not only dilate the blood vessel near your penis, it dilates your blood vessels everywhere. Okay.
Right.
So basically, what are the side effects that you can expect? You can expect blurring of vision, redness of eyes, severe backache, severe, a lower limb pain, and headache, all these things. But they're all short-lived. One. Second, these occur in only about 2 to 4% of the population. That is, if I give Viagra to about 100 patients, 4 of them maximum might develop these side effects. Rest 96 of them would not actually have any side effects.
Right. And so it's generally speaking safe to take with certain possible side effects.
Yes. Now, when we say it is safe to take, we have to be really concerned about it because there are some young men who are more, prone to abuse it.
Right.
Now, let's say if a person, like I have patients who keep on telling that they take in Viagra from beginning of their sex just to make sure that they do not fail. They start popping in a pill. Psychologically, they become so much dependent on it that without a pill, they are unable to perform only. And this is happening even without knowing whether the person actually had a problem or not. Because eventually, if you keep on consuming Viagra daily without any other alternative, let's say in simple terms, if you are not consulting a doctor, and if you are just popping in a Viagra pill on a regular basis, after some time, like any other drug, it will lose its potency in your body. You might not be able to respond. You will not respond to Viagra. Today you're taking 25, tomorrow 50, day after tomorrow 100, and that is the maximum dose. After that, you cannot really take it.
Like a resistance you'll build towards
you will build a resistance towards it. So, not advised to take on a regular basis without your doctor's consultation. To prevent all this, we give a separate group of drugs along with Viagra, which has to be taken.
Okay.
The other major misconception what people have is if I pop in a pill of Viagra, I can do it for a longer time. No.
Yeah, stamina.
Yes. So no. Viagra only helps in achieving a harder erection.
Okay.
But not for a longer time. There are other drugs, let's say SSRIs or anything, which actually inhibit your ejaculation and help you withhold your erection for a longer time. The drugs which are used to prevent your early ejaculation and help you withhold for a longer time are totally different, and they are not Viagras. Okay, they are not sildenafils or any of the PDE5 inhibitors.
They're a different group.
They are a different group. So you have to come out of that misconception where Viagra, if I pop in, I will be able to stay for a longer time, which is a myth.
Myth. Yeah, I mean, and also just almost as a safeguard at this point, you very graciously shared with us some names of the medicines, the different groups as well. I have to ask, are these medicines available OTC or you do need a prescription? I mean, I know in India there's a way to get everything you want with or without a prescription, but clinically speaking as well as legally, are these OTC or are these on prescription? No,
it should not be given over the counter. It should always be taken with a prescription.
Yeah.
Okay. Sometimes it can lead to very major side effects. Let's say sometimes, very, very rarely, it's they call it as non-ischemic optic neuritis, which is a permanent blindness kind of a thing which can occur. I've never seen a case till date, but it can occur by books, and it should it's there in the books because it has occurred earlier. The other one being that there are few patients, usually as I told you, these are patients who have ED, are patients who actually have heart disease, especially in the elder age. So there are a group of drugs called nitrates which are being given to these patients sometimes, not all patients, sometimes. Now, the only absolute contraindication for Viagra, where a person is not supposed to consume Viagra no matter what, are these patients who are already on these nitrates.
Okay.
Now, if you go buy it over the counter, the pharmacist would not know what drugs you're taking, what is it, can you take it or not. So I would recommend, do not take it over the counter. Always take it with a prescription. It
always helps to first talk to a doctor to even figure out whether you need it.
Yes.
I think the point we were reiterating.
Yes.
I think this is a place where I want to actually ask you some of the audience questions, because that will probably help us gain more clarity. So I have to take you to a segment which is called Ask Your Question, where we ask all of your questions which you send in to us anonymously. In case you have a question that's not been answered so far, there is a link in the description to send it to us now. But right now I'm going to continue chatting with Dr. Karthik. So, the first question that I have for you today is, I have ED. Do I have another option for treatment if I don't want to take Viagra?
Yes, there are various options available. Viagra naturally is the most effective and the cheapest, but some people might not be able to tolerate it. Some people are somehow really against it without any reason.
Okay.
Now, coming to the other drugs, we have other drugs called nitric oxide donors, or things where I just give more nitric oxide, as I explained. This thing. So that can be done. Or we have procedures, like we have something called as a penile shockwave therapy, where I give some ultrasound waves to the penis, which helps you in releasing more of certain chemicals called vascular endothelial growth factors, which in fact, in simple terms, they improve your blood vessel quality. Okay, so that can be tried. Okay, there are devices called vacuum erection pumps, like in really elderly men who cannot really use Viagra or do not want to use, then you can use these pumps. But of course, they come with their own minor side effects, like painful ejaculation or the penis being very cold, things of that sort. The other one is self-injection. You take Viagra acts throughout the body. Now, I don't want a drug to act throughout the body because of the side effects, so I just give a small insulin syringe with a pre-filled medication in that, where just before sex, the patient actually injects it to the penis, and he'll get an erection. But however, these are all quite complicated. Maybe shockwave therapy is right now in the market and more popular. Maybe if you are not really willing to try Viagra, you can try this, but with clauses applied.
Right. And in terms of clinical therapy, going beyond medication, does that work as well?
Yes, definitely. If it is, first of all, I need to tell you that if you have ED, consult a doctor, because as I told you, it's not as simple as like you have ED, you just pop in Viagra, it goes away. No, it can actually be an indicator for your underlying heart disease or anything of that sort. I've had patients where I've tested them for ED and then just got an ECG done and found out that there is a heart issue.
Right.
So more than that, there is therapy. If at all, it's not an organic problem and it's just psychological issue where the relationship with your partner is not good, or it's just simple anxiety which is causing this erectile dysfunction. Consulting a therapist or going into therapy would probably help you a lot more than what actually a Viagra would do.
Right. Great. I think I am going to take the next question and kind of keeping the conversation in medicines and talking about medicines. The next question is that my local chemist does not have Viagra. They sell something called Penagra. Is that a thing?
Yeah.
Can I take that? That's the question.
Yes. One, as I told you, the disclaimer, take it if your doctor has prescribed.
Yeah.
Then next you have to realize Penagra, Viagra, both are same. Viagra was the original compound which was discovered by Pfizer, which is slightly more expensive in the market right now. Let's say 500 rupees a pill. Whereas Penagra is the generic version made in India by a company called 𝐓𝐨𝐻𝐿. It's kind of cheaper. It's about 25 to 50 rupees per pill depending upon the dose. It can be taken safely. Both the drugs are same. Nothing to be worried about. Efficacy is the same. Nothing to be worried.
Yeah, I think that's what I wanted
to ask. But take it with a prescription, as I
absolutely, just like Viagra would be taken. So next question we have here is, I don't have a sexual health concern. Can I take Viagra just to have better sex?
Not really. Again, it's like asking, can I pop in a paracetamol even though I don't have fever? No, it's there for a problem. So you have to use it if you have a problem. If you abuse it, then naturally it comes with its own side effects. You might actually develop a problem where you become dependent on it. So I would not recommend it without consulting your doctor.
Got it. I think this is built on the whole notion where people feel like Viagra equals to better sex automatically. So the last question for today's segment is there a natural form of Viagra that I can take? Any foods, teas, etc.
Okay, so as I already told you, the idea here is to keep your vascular health intact, in the sense to keep your blood vessel quality intact. Naturally, there are certain food ingredients with more antioxidants, let's say dry fruits, citrus fruits, or anything. But more than the natural, it's not like you pop in this and you'll be really healthy.
Right.
The most underutilized Viagra is exercise.
Oh.
If at all you are exercising about 40 minutes of cardio per day, that will help you in maintaining your sex life and general health as well. Because at the end of it, the take home point here, what I want to tell is sexual health is not only sexual health. It actually indicates that, your physical health also. Like, if your penis is showing a problem, it means that your heart is also at risk.
Yeah.
So be verified.
And to your point, we always at Allo, we always say sexual health is equal to mental plus physical health. And I think that's what we're getting at here right now. And I know I've taken so much of your time, but I do have to ask one last thing. We just spoke about exercises being almost a natural form of Viagra. Are there some specific types of exercises you suggest, or like certain kinds of trainings that you suggest for the same?
Most commonly, when I tell exercise, people just go hit the gym, lift weights, all these things. But the exercise which actually matters here is cardio.
Right.
Like I have patients who come and ask me, I do yoga every day, I still have this problem. It's not that you exercise and you don't get the problem. No, this will help you in preventing the problem. Maybe milder forms of the problem get cured by this also.
Right.
And the type of exercise what I'm recommending here is cardio. About 40 minutes of cardio. Let's say it's running, swimming, jogging, badminton, anything, which increases your heart rate till that point and then gets it down. These are the ones which help you maintain a good blood vessel quality. This will not only help you from preventing or getting any sexual dysfunction, but also help you in maintaining a healthy heart, healthy blood vessel, preventing heart attacks, all these things. Let's face it, I'm telling you, it's mild to moderate exercise, 40 minutes to 1 hour a day. Not really, severe exercise that will have its own side effect. So 40 minutes to 1 hour of cardio is what I would recommend.
So actually, just to put it back into a form, sexual health improvement can be one of the outcomes of cardio itself.
Yes.
Right. I think that's a really great point for us to close this conversation. I do have to tell you, I have lots of more questions, but I think I'll have to have you here for another episode. Is that okay with you?
Definitely.
No, we'd love to hear more from you. And all of you, please keep your comments coming. You give us so many great ideas for episode topics as well. And I am looking forward to all of you writing to us. Until then, it's Dr. Karthik and Artika signing off. Take care and bye.
As a sexpert.